Hi there. Hopefully you've heard that breastfed babies feed really quite frequently and often, and that's normal. But it does beg the question, why do they feed so often? And sometimes it can be really helpful to understand what's going on there, because it can, help you cope with the situation and be more relaxed about what's going on as well. Thinking about your tiny little baby that's just been born, who is basically transitioning from one world to another. They were held permanently in your womb, and they could hear your heartbeat constantly. They never had to ask for food, etc., etc. And now they're out, and they've got to transition to this new way of being. And of course, what do they want to do? They want to be with you. Naturally, that is going to be a very strong survival instinct for them. And if they're at your breast, then they know that they're safe and they're going to be nurtured by their mother or their parent while they're at their breast, their chest. It's really important for the baby's instincts to be responsive to your baby. Put them to the breast and chest as often as they signal. And thinking about the signals as well, the signals are really important because we need to feed little and often in order to bring our milk supply on. We need to tell our body, we have a baby, come on, make some milk, let's get going. We need to feed this little one. And the only way your body is going to know that is if we remove that milk. And breastfeeding really does work on a use it or lose it type basis, so supply and demand. So the more milk you remove, the more your body's going to replace. And it doesn't work by sort of your breasts filling up and then it gets used up and then you've got to wait for them to fill up again. That's not how it works. Women are we're not a warehouse, okay? We are a factory, or we're a river. We're not a lake. So we're constantly making milk. It is a constant production line. Obviously the production line can, speed up and slow down. But the speed up and slow down actually depends on what's happening at the breast. So that's why removing milk frequently, it's telling your body, keep going, keeping that production line, going at a really good rate of knots sort of type thing. Because when your breasts get really full, what happens is there's a protein within your milk called fill that feeds back to your body and says, whoa, slow production down. And that can be really important in the early days when you've perhaps got a lot of milk. But obviously, if you keep letting them fill up too often, then, it's going to have that negative effect on your production. So little and often prevents that from happening, basically. It allows your production to keep going at full tilt and what is needed to sort of feed your baby. And it allows your body to adjust to what your baby needs as well, so that your supply can regulate and match your baby's needs. Of course, the other thing is that breastfeeding is more than just nutrition, as I hinted at the beginning, that, they like to be at the breast because that is comforting. You are their environment. They don't even really know that they're apart from you as yet. And so they want to be close to you, and being at the breast is that way to achieve that. And it's wonderfully comfortable and soothing for your little one to be there most of the time. Hold your baby, cuddle your baby. It's really, really normal. And breastfeeding is a way of mothering or parenting your child rather than just a milk delivery system. It fulfills a lot of needs. It fulfills skin to skin, thirst, pain relief, relief from overstimulation or understimulation, and most importantly, that sort of security and that connection back to, their mother, basically. Little and often is really nature's way because it keeps everything ticking over nicely, essentially. When we sort of try to separate a little bit too much, that's when things can go a little bit awry because it's not as, intended. So don't be afraid to pick your baby up, cuddle them, lots and lots of skin to skin, and hopefully you understand a little bit more about where your baby's coming from so that you can understand being at the breast frequently really isn't a problem. It's pretty normal. It's tiring. Yes, absolutely. I will not deny that. I've been there, done it twice, so I totally get it. But it's not a problem. as such. And obviously we just have to navigate our way around it as best we can as parents. And of course, just reach out for any support or help from Maddie's Medical, the National Breastfeeding Helpline, your local group, your health professional, any lactation consultant, so that if you've got any concerns at all, you can talk them over and, you know, use the benefit of their experience to maybe navigate yourself gently into parenthood. All right, take care.